Hello, everyone. Good morning, good afternoon, good evening. I'm very delighted to welcome all of you to this webinar. My name is Hitesh Hathi. I'm speaking to you from Cambridge, Massachusetts. I'm with the Mittal Institute at Harvard University. This event is hosted by the Lakshmi Mittal and Family South Asia Institute at Harvard, also the Harvard Center for African Studies, especially their Africa office, and the Center for Labor and a Just Economy at Harvard Law School. And on behalf of all these institutions, it's really my privilege to welcome all of you here for this very special gathering for something that's very urgent and important. Since I'm with the Mittal Institute, let me just take a minute to tell you something about it. The Mittal Institute has the mission of connecting Harvard with India and the wider South Asian region. We do work in a variety of areas. Our mission is really Harvard's mission, which is to generate new knowledge and to teach it. We have been doing very serious work in healthcare, in the arts, in education, and especially in climate change, focusing in climate change, especially on heat. We launched 2 years ago a climate platform specifically to study the issue of climate change, heat, and heat adaptation in South Asia. Last year, we convened India 2047, Building a Climate Resilient Future, which brought together leaders in climate science, health, labor, business, and urban planning from around the world and from India for a conference that we hosted with the Salata Institute for Climate Change at Harvard. And Sharon, whom you'll hear from in a minute, was one of the key speakers there who helped us put it together. Sharon will tell us more about this webinar, but I just want to say that we are facing a global crisis of rising temperatures, heat waves, with multiple issues, some of which we are just beginning to get a handle on. And this really today is a chance for us to explore how cities like Ahmedabad, Boston, Cape Town are developing heat action plans to meet this global crisis. So with that, let me introduce our moderator, Sharon Block. Sharon is a good friend, I should say. She's professor of practice and executive director of the Center for Labor and a Just Economy at Harvard Law School. She's really among the most distinguished faculty members at Harvard Law School. For 20 years, she's held key labor policy positions both in legislative and executive branches of the US government. She served in the Obama administration and also in the Biden White House. In the Biden presidency, she helped launch the process of developing standards to protect workers from extreme heat, both indoors and out. The drafts of this plan were released by the US Department of Labor in the summer of 2024, a summer which also saw heat emergencies everywhere around the world. So with that, Sharon, let me turn it over to you. I want to welcome all of you who are listening and all of our panelists who've been kind enough to join us. I will be here, but we'll go off the camera so that the focus is on those who are speaking. Sharon.
Thank you so much, Hitesh. A kind introduction, and thank you to all our partners at Mittal and the Harvard Johannesburg office. So I want to sort of situate today's webinar in a larger stream of work that we're doing. This session serves as a kickoff to a scholarly working group that we're working on with Dr. Sajid Balsari at Harvard Medical School and the T.H. Chan School of Public Health on occupational exposure to extreme heat. And thanks to the Harvard Global Health Initiative for sponsoring that work. And thank you to the colleagues from that effort who are joining our today's webinar. But all of us here in the United States, we're just at the end of the summer season, and even here in the United States, even in Boston, as far north as we are, we are all living the urgency of the topic that we're going to talk about today. So I want to frame the panel a little bit as we get started. So our focus today is on heat action plans. So let's start with the definition of a heat action plan. The Atlantic Council and the Arched Rockefeller Foundation's 1 Billion People More Resilient program has a good definition, I think, and that's that a heat action plan is a document that integrates a portfolio of assessments and actions to respond to and reduce heat-related impacts. So our interest in heat action plans started this spring when, as Hitesh referred to, I was delighted to join my colleagues from the Mittal Institute um, for the India 2047 conference. And that conference, as Hitesh said, had a theme of building a climate resilient future. So we spent 4 days in New Delhi with over 150 experts in many disciplines from around the world. My role was to lead the workers track of the conference, and we heard from scientists, public health experts, lawyers, government leaders, union leaders, and advocates for workers of all stripes about the impacts of extreme heat on work and workers. But equally important to the conference, I was honored to arrive in India early with a group of colleagues from Harvard to visit the workers organizing with the Self-Employed Women's Association in Ahmedabad. And there we saw firsthand how workers and their advocates are creatively dealing with the reality of heat on the ground. We also met with the team at the Center for Environmental Planning and Technology in Ahmedabad and the team that developed that first heat action plan. And we are so lucky that Dr. Malavankar from that team is joining us today. It was really a key experience in our time in India. But once again, it's become clear that workers need to be able to share their voices and their experiences and expertise in designing the adaptations needed to address the crisis of extreme heat. So between the conference and the visit with workers, we returned to Cambridge with a greater understanding of how to work across disciplines to find creative ways to protect workers. As Sewaz Mansi Shah put it when we were in India, we can't keep working in silos. So, as Hitesh referred to, meanwhile, back in the US, the Biden administration had proposed workplace standards last summer to protect workers from exposure to extreme heat, whether inside or out in the United States. But the fate of those standards is genuinely unclear given the transitions in the US government. So, none of us want to sit back and wait. So we wanted to talk to leaders in cities around the world about the value of heat action plans, where cities and states can educate employers and workers alike about the necessary precautions that they need to take in extreme heat and to put in place processes in developing these plans to hear from workers themselves about what they are experiencing and what kinds of protections and supports they need. So we really want to highlight the important role for workers in developing these plans. So today's webinar is a kickoff to that conversation, which, as I said, will be continuing at least for the next year or so, where we can hear from experts who have been in the trenches, so to say, helping workers adapt to extreme heat and designing plans to give guidance to employers and workers and other government officials alike. So we're so excited to have such accomplished panelists with us today. So I'll start with Zoe Davis. Zoe is a senior climate resilience project manager in Boston's Office of Climate Resistance. We love having somebody from across the river with us. So thank you, Zoe. She led the development of Boston's heat plan and now works to turn strategy into action, advancing initiatives for both long-term resilience and immediate relief. She collaborates with regional coalitions like the Resilient Mystic Collaborative and Metro Mayors Coalition to strengthen resilience at a broader scale. She'll discuss some of her cross-departmental efforts to integrate resilience into planning, design, and summer preparedness to help increase access to cooling resources. We also have with us, we're very honored to have with us, Albert Ferrara. Albert is the manager of the Resilience and Climate Change branch in the city of Cape Town. He's an urban planner by training and holds a master's degree in urban planning, specializing in resilience, as well as postgraduate qualification in public health. His experience spans policy development and research across urban planning, resilience, economic development, and the integration of public health into city systems, all those things that you need for a heat action plan. Albert also serves as co-chair of the city's integrated urban health program, which focuses on reducing vulnerability and improving the overall health and well-being of Cape Town's residents. We also have with us Dr. Rajvi Joshipura. Dr. Joshipura is a senior coordinator at the Self-Employed Women's Association, SEWA, in India. Her work concerns climate change and human health, disaster impact assessments, digital tools for public health, and science communication. She represents SEWA in global forums like the ILO and the World Health Summit regional meeting, and has co-authored publicly contributed to pieces on heat risk, resilience, and parametric insurance affecting informal women workers. She often represents SEWA's climate team in external research collaborations. And we have, as I mentioned, we're very honored to have with us Dr. Dilip Mavalankar. Dr. Mavalankar was the director of the Indian Institute of Public Health, Gandaga, Ganaganar, you'll have to help me with that one. As its director from 2012 to May 2023, Dr. Mavalankar received an MBBS and MD in preventative and social medicine from Gujarat University in Ahmedabad, and a master's in public health and a doctorate in public health from the Johns Hopkins School of Hygiene and Public Health in the United States. His work experience includes faculty and research positions at the National Institutes of Health in Bethesda, Maryland in the US, the Indian Institute of Management in Ahmedabad, India, and the Mailman School of Public Health at Columbia University in New York. He has worked as a consultant advisor to the WHO, World Bank, UNDP, UNICEF, and many other organizations. He's been on various high-level committees and boards of government in India. He's a member secretary of the Gujarat government COVID task force appointed by the leadership in Gujarat, and he helped develop the Ahmedabad Heat Action Plan in 2013, which has now been scaled up in many cities in India, and we're going to talk about how important that experience was. Okay, enough of me talking. Now you know the amazing panel that we have and what we're here to do. So we're going to get into it. I'm going to open up with a round of broad framing questions, and I'll give each of our panelists about 7 minutes to tell us about their work in this area. We're going to leave plenty of time for questions and discussions, so please feel free to submit questions if you have them using the Q&A function at the bottom of your screen. And after we get through this initial round of questions, we'll be taking your questions, and so you will have the opportunity also to talk to this amazing panel. So, Dr. Mavalankar, I'm going to start with you. I know you were very involved in developing Ahmedabad's groundbreaking 2013 heat action plan, which one study suggests avoided more than 1,100 deaths annually in the years following the plan's implementation. Can you tell us a little bit about the Ahmedabad heat action plan, how it came to be? And I think really for our purposes also, it's important to understand how other cities are sort of building from your work as this practice of heat action plans grows and develops.
Yeah, sure. Thanks, Sharon. I have a few slides, so can I request my first slide? But let me preface that many times disasters spawn new actions. And the first slide, yeah. So this is the one, yeah. So what I'm going to talk about is the experience of developing this Ahmedabad heat action plan. But as I was speaking, it came out of a major disaster in 2010. Can I have the next slide? It's a complicated slide, but if you look at the red line on the top, on 21st of May 2010, the city temperature rose to 47 degrees centigrade, which is roughly like 120 or some such number. I don't know what Fahrenheit it will convert to. But very high temperature. Normal temperatures in Ahmedabad those times should be around 42 to 43 degrees, which is the black line. Now, when this heat wave hit Ahmedabad in 2010, After a year of this, when we analyze the records of birth and death, especially the daily deaths recorded in the city, it went from about 100 deaths, which is a normal daily mortality of all causes in Ahmedabad, to 310 deaths recorded on 21st of May. And following that, you see these vertical brown bars. It comes down to the normal of about 100 on 27th, 28th of May. So this simple analysis of correlating the heat wave temperatures, maximum temperatures, with uh, the daily mortality, gross all-cause mortality, showed us that even in a regularly hot city or historically hot city of Ahmedabad, within 1 week of a heat wave, 800 additional deaths happened. And in the month of May, which was normally much hotter in 2010, there were about 1,300 additional deaths which happened. So that shook the city as well as its institution and people, saying that we must do something for developing a mechanism to protect people from this kind of heat waves. Next slide, please. What further analysis showed is that when we looked at the heat stroke labeled deaths in 5 major hospitals of the city, there were only 76 versus 800 additional deaths and 1,200 additional deaths in the whole month. So basically, if you look at the death certificates with the cause of death as heat stroke, you will only find 10% of the actual additional mortality. And that is why I put this heat, the iceberg phenomenon of heat wave mortality. Next slide, please. Following that, the Indian Institute of Public Health analyzed last 15 years of mortality and temperature. So this is a simple scatter diagram of maximum temperature on the horizontal axis and daily all-cause deaths on the vertical axis. And looking at this curve, the city decided to have 3 kinds of alert: yellow alert at 41, orange alert at 43, and red alert at 45 degrees centigrade. And that formed the basis for the heat action plan. Next slide, please. The heat action plan was launched in 2013 by the city government, which is what we call as municipal corporation, with the help of the Public Health Institute where I worked and the NRDC, which is an American NGO, Natural Resources Defense Council. And the plan had 4 major pillars. One was early warning system and interagency response plan, public awareness and community outreach to alert people when the warning comes, capacity building of medical and paramedical professionals and hospital systems, and long-term measures of reducing heat exposure and promoting adaptive behavior. Next slide, please. I can't go into details of each because the time is very limited, but this is just the 4th intervention, which is much more visual. The city developed green areas, and on the left-hand panel, you see the gardens as well as new urban forests developed using Miyawaki forest methodology, additional free water supply, because for poor people, people on the road, water is the main source to protect against heat, and cool roofing, white painting on the roof of the poor people who have either asbestos cement roof or tin roofs. So these were some of the adaptive measures created over the years from 2013 onwards. Next slide, please. The actions, especially for workers and people on the road, because that is the main focus, was first of all advice to the workers and working populations that work in shade as much as possible, take cooling breaks after every hour for a few minutes, ensure hydration and availability of water, drink water even if you are not feeling thirsty, And if you feel unwell while at work in hot sunlight, take immediate first aid. Cool the person, take him, spray water, etc., and take him to the health center. The second was change in working timings as and when possible. Avoid work between 12 to 4 p.m., which is the most hot time of the day, and especially on the red alert days where the predicted temperature is more than 45 degrees. Then some of the NGOs, and you will hear from Rajvi, Dr. Rajvi, that parametric insurance was later on tried out over last 2 years with SEVA and MHT and some other organizations. Another organization called All India Institute of Disaster Management tried out with small uh, grants to people who are working in small businesses to protect themselves from heat and what kind of adaptation they themselves can do using small amount of money, which was like $5 to $10 equivalent, or maybe $20 equivalent small grants to individuals. Then cool roofing for home-based workers. MHT and even the city government provided cool roofing uh, to many people who are living in slums and who work at home. This is cool paint on the top, which reflects heat and reduces the inside temperature by 2 to 3 degrees centigrade. Recently, last year, one of the NGOs, MHT, tried a cooling bus stop because many people have to wait at bus stops at very odd times and very hot times. They have water sprinklers which will cool that area. So those kinds of innovations are also tried. The city government has also a plan to provide drinking, free buttermilk for drinking through NGOs on red alert days. So many things were done to help the workers and people who are on the road. Next slide, please. What was the impact of this? If you see the graph, it shows you the relative risk of mortality in the city of Ahmedabad in the summer and at different temperatures. Bottom horizontal axis shows that after 44 degrees centigrade temperature, the red graph, which was pre-heat action plan years, is much steeper and higher than the black graph, which is post-heat action plan years. So this showed that after implementation of the heat action plan, the mortality substantially reduced by 30 to 50%. And an pilot evaluation done in 2017, published in 2018, showed that almost 1,200 annualized deaths were avoided after the heat action plan in the city. So this became the evidence which the National Disaster Management Authority took and helped replicate such plans in many, many other cities. Thank you very much.
Thank you so much, Dr. Mavalankar. And I think you gave us such a great picture of sort of how a heat action plan can come into being. And one thing I think your presentation highlighted, which is a good segue to our next panelist, is that we need to think about, obviously in India, the informal sector is so large, it's natural to address that dynamic for workers, but for our US audience, this is a big issue in the US too, and really across the world. We might call it different things. In the US, we refer to independent contractors, gig workers, but not everybody has an employer in the traditional sense. And so it's important that heat action plans take that into account too. So again, great segue to talking to Dr. Joshipura. Can you share with us, because Sewa is such a leader in thinking innovatively and creatively about how to protect workers in the informal sectors. So what are the lessons learned from your work protecting workers from heat? that you would want, that you think are appropriate for cities to consider when they are developing their heat action plans? What's those key factors for workers in the informal sector?
Thank you, Professor Sharon, for the question. Namaste and greetings to everyone. So SEWA is a national trade union of about 3.2 million informal sector women workers spread across 18 states across India. But for these informal sector workers, heat is not an abstract climate statistic, but it's all about their survival. Every summer, women have to choose between staying safe at home and watch their families go hungry or risk their health in the scorching sun and go out and continue working. But at Seva, we believe that we have faith that there's a ray of hope amid all the adversities. And hence, on the occasion of our 50th anniversary, that was in 2022, our members collectively resolved to focus on climate action as the central theme of all its activity. And we took up a collective campaign called the Swachakash campaign. And it translates to the Clear Skies campaign, where the focus is that the climate action has to be a collective vision and mission to support actions across all the activities and to ensure that clean sky is a fundamental right for everybody. So the campaign entails building an economy of nurturance by weaving together climate resilient livelihoods, environmental security, health and wellness, food security for all the members and their communities. And as a part of the campaign, we have several activities. It includes education and awareness, linking members to different other adaptation measures, mitigation measures, linking them to climate finance. But the lessons that we have learned over a period of 2 to 3 years is that the first one is ensuring their timely information access. It saves lives. We all have early warning systems in place as of now, but the key and the crux of ensuring its effectivity is that the messaging is curated as per the trade, as per members' occupation. It's in their local language, local context. We have also had certain pilots wherein we use the behavioral centered design, which triggers their emotion and motivates them to follow the preventive measures. Then the next is that health systems must go where the workers are. So it is very difficult for the informal sector worker to give up on their day's wage and go seek care at a hospital because they'll have to wait in long lines, compromise on to their daily wages, plus spend on the out-of-pocket medical expenditure as well. Hence, we organize camps. We have a telemedicine service in place wherein if members cannot go to the clinic or a camp, they can access to medical advice via the telemedicine and is free of cost. And lastly, we have a network of our own trained Seva health ambassadors who focus on both preventive and curative care. And as soon as like during the beginning of the summer itself, they'll mobilize within the communities, have narratives, posters, small stickers, which motivate members to focus on preventive healthcare, like take short breaks, stay hydrated. These are the symptoms of heat related illnesses. In case you see any of them, consult a doctor. The third is that adaptation must be universal. Like we shouldn't be considering any of the adaptation measure as privilege. So we have our green village and green wards wherein women are motivated to adopt mitigation and adaptation measures like cool roof, solar fan. Then there are community water coolers to facilitate access to potable drinking water. Then there's drip irrigation, tree plantation. These are the small initiatives which members can themselves take up and are locally led. Hence, the scaling up of these interventions become really very easy. In addition to this, we have a campaign wherein we link members to different adaptation and mitigation measures. Although they might not be contributing significantly, but they minimize their livelihood loss and prevent different health repercussions as well. And lastly, there's in Ahmedabad, we have like a lot of green initiatives going on. One of them is setting up of the material recovery facilitation service and the value creation center. So the key is accessing members to sustainable livelihoods. So this is about the urban areas, but in rural areas also, there are a lot of capacity building programs wherein we are training our own grassroots leaders as solar entrepreneurs, climate entrepreneurs, data entrepreneurs. So in case their livelihoods get hard hit by, say, a heat wave, they don't have to rely on anybody else or borrow money, but they can continue sustaining their livelihoods. And last is financial protection is the key. Women and workers will be empowered if the finance is in their hands. It's all about climate justice. So, as Dr. Maulankar mentioned earlier, we have piloted the parametric climate insurance, and it has been a game changer because members don't have to rely on informal sources of money lending, but they have their own security in times of worst needs. And it is pretty different than the traditional insurance wherein the overall claims process is eliminated and they get access to immediate finance. But it also has some limitations like the standalone parametric insurance. All of us agree that it is innovative, but there are risks of members suffering from high basis risks. Then the trigger thresholds might be very high, whereas the losses and the impacts start occurring at quite a low temperature. And what happens during the non-payout years? Members will still be affected. There still will be losses. They will still suffer. And hence, this year we started with the climate welfare facility, which is members' own worker-own climate safety net and has multiple components. The first one is savings. So point one, this becomes a self-sustainable solution. So it's savings, insurance, returnable grants and advances, but holistically approaching the solution. It also has mental health response, it has a climate and health response, early warning systems are also embedded into it. And so this year we piloted this with 40,000 members. And as a result of the program over the past 3 years, we have linked about 37,000 members to financial and social security. And hence the control, the autonomy stays within them. And the strongest and the last lesson is organized workers are safe workers. Any city that wants a successful heat action plan must invest in capacity building, building worker leadership, and ensuring that while the plans are being designed, they have a seat in the decision making.
Great. Thank you so much. And that's a great note to conclude your opening remarks on. I like that. Organized workers are safer workers, and we know there's a lot of research and data to back that up. So thank you for sharing that with our audience. Next, we're going to hear from Albert Ferreira from Cape Town. So Albert, we know that Cape Town started with a climate change action plan that's led to the development and implementation of a more focused heat action plan, which includes worker protections. So can you tell us more about the context for that shift to a heat action plan in Cape Town? What workers in putting the plan together, what workers did you identify as sort of most at risk? And then how did you approach figuring out how to protect those most at-risk workers?
Great, thank you very much, and thank you for the opportunity. Yeah, so I just prepared a few slides, and there are a lot of prioritized climate hazards and shocks within the city of Cape Town, and heat being one of them. So that's interestingly, we're moving on to looking towards a flooding action plan as well. You're welcome to go to the next slide. So just a little bit of context for those that have not come to South Africa and Cape Town before. So Cape Town is located almost at the southern tip of Africa, around 2,500 square kilometers. So it's a relatively large metropolitan municipality and about 5 million residents. Just in terms of our local climatic conditions, so we have a predominantly Mediterranean climate, so very similar as sections of Australia, California, and then of course the Mediterranean. Our hot and dry summers are between November and February each year. So similar to other coastal regions of South Africa, we're expecting and experience the projected climate and warming increase is around 1.5 to 2 times the global average. As you can see with those projections, there's some serious concern going into the future. What is important to understand is that the risk isn't experienced in the same way within the city. So if you can look to the right-hand side, there is urban heat island assessment that was done with certain areas, for example, built-up areas experiencing higher heat, and noting that there's some microclimates that need to be acknowledged. But importantly, in the South African context, inequality matters and vulnerability matters. So while the temperature in certain communities might not be as extreme in others, so for example, in our central business district, we might be experiencing 40 degrees, while in other areas only 30 degrees on the same day. If people are living in informal settlements, etc., they will experience that heat and heat risk in a different way. You can go to the next slide. Okay, so this is just a little bit of a breakdown of the local economy within Cape Town. So as I mentioned, we have around 5 million people, 1.8 million people that are employed. And to note that, while Cape Town has a high unemployment rate, so that's a broad unemployment rate of 25%, that is relatively well compared to nationally and other big cities. So any form of risk towards employed people, either informally employed or formally employed, is something that needs to be taken seriously. And within this landscape, Cape Town makes up around 10% of the GDP as well as total employment. So what happens in Cape Town really matters for the rest of South Africa. So if we look at the breakdown in terms of the sectoral breakdown in Cape Town, we have a unique situation in South Africa. As a developing country, we have this strange situation where we both have a high unemployment, but also a small informal economy. So a lot of that refers to the structural constraints in South Africa and the history of South Africa, and there's clearly barriers to entry. So just to note that the informal sector is relatively small compared to others, but it's still a significantly important sector within the city. Then if we kind of move towards like the breakdown of it, so we have quite a diverse economy within Cape Town, dominated by financial, community service, etc. There's some agriculture, and then if we zoom in terms of the risk that heat poses to workers themselves, of course, agriculture is going to be impacted. And just to note that Cape Town is within the larger region, agricultural region. So a lot of produce flows through Cape Town. So that's why we also have a lot of jobs within trade, hospitality, etc. So if we start looking at the breakdown of them, so if we first focus on the formal sector, of course, there's a lot of general protections for people that are formally employed. And there's occupational health regulations, which I'll mention in a second, which they have, but they're still at risk sectors. So, for example, construction, manufacturing, and others. And when I talk about risk, I talk about internal temperature risk, so people working in hot conditions in buildings, and then people of course outside. But particularly important is the informal sector that are at risk. So if we look at the different subsectors, including informal traders, informal waste pickers, and people in the informal construction industry, by their the sort of the employment nature, that then they are more at risk in general. So that is the workers themselves that are at risk, but we also need to remember that the sectors are at risk because of increased heat. And as was mentioned earlier, around big crises. So we've had, for example, regional drought not too long ago, referred to as day zero, where our taps nearly ran dry, and that had a lasting impact on economic activity as well. So we have to consider these sectors not just in protecting workers, but also safeguarding these jobs for the long term. You're welcome to go to the next slide. So I think it's important to understand what is the powers within South Africa, within a South African local municipality to act, because this is also interesting to see what other cities have done, because their mandates and constitution, etc., differ. So labor laws, health regulations, safety regulations, the national government competency, but local government has a really important role to play. So we have direct mandates in terms of service delivery, but then we have important other mandates like municipal planning, We manage informal trade in general, community facilities, disaster risk management. So yeah, and again, the city as a major employer of around 26,000 people, we also have a responsibility with regards to that. So as mentioned earlier, we have our climate action plan, which then resulted 2 years later in 2023 in the development of a heat action plan. So broadly, the plan picks up on a risk prevention, readiness, response, and then this research and knowledge component. But if we kind of zoom in a little bit more around heat and workers specifically, one must acknowledge like our general reducing the impact of heat in communities overall will of course also have a positive benefit for workers. So there are some general mitigation approaches around urban greening and infrastructure investments. Then we've done various sector-based heat assessments to identify particular response interventions. We have a big heat and health communication plan, and the idea now is to not just have sort of generic communications, but start to target it into specific at-risk groups. Importantly, we're working on real-time heat monitoring, early warning systems, and by again referring back to informal workers, they are often difficult through normal communication channels to target. And then we've developed high heat day and heat wave guidelines for city workers. But what we've realized is, as a big employer, we have a lot of lessons to learn with other big employers in the city, so on the formal side. And then what we are now exploring is how can we utilize the platforms that we already have with informal sector workers. So, for example, we have platforms with informal traders in the city, and then we invest in infrastructure which can aid in terms of reducing the immediate exposure to heat, etc. So what we're moving towards is just our next phase is really going to be focused more on co-creating and particularly working directly with community organizations and intermediaries to make sure that we are able to target our heat actions and heat action plans to workers which might not be targeted otherwise. Thank you very much. And just on the last slide, there's a link over there where you can visit our Beat the Heat webpage, and that's our yearly campaign around the festive season. So we have a hot Christmas and a holiday season over December. And yeah, just a little bit more information about what we are doing in the city. Thank you very much.
Thank you, Albert. And I feel like you all are just bringing out the important themes. And just one thing I want to underscore what you said, because I think it's really important across all of the cities and really anywhere any city that's thinking about this, that inequality matters. And that is a component of heat action plans, which again, I think is a great segue to our last panelists for these opening remarks. So Zoe, I know you've been very involved, as we talked about, in developing Boston's heat action plan. And that you actually had the challenge of gathering this community input in the midst of another global crisis, the pandemic. So let's hope it was a once in a lifetime crisis, but who knows, we might need another webinar about that. But anyway, can you tell us about how public engagement helped inform, even under those trying circumstances, how this public engagement helped inform Boston's plan and how your efforts to implement the plan, right? It's one thing to put something on paper, it's another thing to make it real in people's lives. So how's it going, Zoe?
Thank you for the question. It would be great if we could share some slides and then I'll get into it. I'll start with actually a bit of a primer on the heat plan, and then we'll get into some of the community engagement pieces. But you can flip to the next slide. Thank you. So just as a bit of a background, the city of Boston has been doing climate planning for around 10-ish years, at least. Specifically climate resilience planning. So Climate Ready Boston is the city's first resilience plan comprehensive plan looking at all of our vulnerabilities to Boston. We particularly identified stormwater flooding, coastal and riverine flooding, and extreme heat. Boston, as a coastal city, has narrowly escaped a number of pretty significant historic hurricanes. And so looking at flooding is sort of one of our number one priorities. Flooding is very charismatic. As I mentioned, we're right on the coast. And so we actually, as a team, have focused on a lot of our coastal resilience work. And once we had finished all of our neighborhood coastal resilience planning, we then moved to looking at extreme heat. So you can flick to the next slide. Extreme heat is, of course, a part of Climate Ready's plan, but we wanted to go deeper to define more specific strategies, better understand, get an understanding visually and spatially for how heat shows up in the city of Boston. So in 2022, we released the heat plan. We actually started development of the heat plan in 2019, had a 2-year planning cycle from 2020 into 2022. This is our framework for how we're going to prepare for the impacts of extreme heat, both in today's summers, but also preparing for our future summers. Just to orient folks, this is Boston, looking at Boston from a daytime temperature perspective. Just to note that the blue areas are not cool, they're just cooler. This is a snapshot of Boston in an extreme heat event. So even the blue areas are above 90 degrees. 90 degrees is our threshold for advisories. So certainly not as hot as some of the areas in India that we heard about today, but it is extremely hot for Boston. As a northeastern city, we are particularly vulnerable to the impacts of extreme heat. For the majority of our year, about 3/4 of the year, we are experiencing cooler temperatures. And so our infrastructure, the way we think about our programs, even culturally and mentally, we are geared towards snow preparedness and cold. But we know from work on the heat plan that in the future, in the next 50 years, we could be seeing up to 130 days over 80 degrees. So that's speaking to chronic heat, and then 60 days over 90 degrees annually. And just to put that into perspective, a meteorological summer is about 90 days. So that speaks to huge climate shifts for Boston, and how we need to be preparing as individuals, mentally, culturally, but also from our infrastructure and operations standpoint as well. So you can flick to the next slide to get into a little bit more of our community engagement process. As Sharon had mentioned, we had run this process through COVID, and we had not anticipated that. So we essentially needed to pivot to how we engage folks virtually and asynchronously. One of the ways that we were able to do that is through co-mapping efforts. This was one of our first efforts during the process. We wanted to better understand how various communities are viewing extreme heat where they live. So we asked folks to identify some of the hot spots that they have noticed around Boston, around their neighborhoods, as well as some of the cool spots. This map particularly highlights those hot spots. So folks were able to share with us, hey, on this specific spot in Warren Street, it's uncomfortable because there aren't trees, there's not shade, or I would like to see more green in and around my neighborhood in South Boston. So this is an effort that we were able to get out through open houses. So we would all sort of come together and talk a little bit about some of these hot spots in Boston, but also we wanted to make sure that accessing this survey and this COMAP was available asynchronously. So we would put out information through our city channels, But through the planning process, we also worked with a community advisory board. So these were representatives from across a variety of neighborhoods and backgrounds in Boston who were able to connect their constituencies, their families, friends, various groups with the efforts that we were moving forward through the plan and sort of take ownership over the information. You can flick to the next slide. This is another one of our community engagement efforts that focused really on storytelling. So this was about halfway through the pandemic. We're really noticing that people were feeling burnt out. There was this sense of lacking in connection. And so we had worked with Suzaki, who is our primary consultant on the project, to develop this comic book builder. And so this was a way that folks could talk about their day, a typical day, wherever they are, from start to finish. What is your experience with heat? Are you feeling good? What are some of the things that you're noticing? And so on the side here, we have QR codes for you to flip through the flip book. So this is the amalgamation of various stories. Or you can build your own comic as well and share about your experience. The last community engagement tool, you can flick to the next slide, that I'd like to share is about sort of the helping community partners to share more about the place-based interventions that they would like to see. So we had originally planned a series of design charrettes. We of course wanted them to be in person, but we thought with Suzaki, how can we do this virtually? Rather than like all sitting around a table and maybe sort of toggling uh, some like physical features. What we did here, I know that this slide is a little messy, but what this shows is how the team was able to live draw some interventions, and as community members were speaking, sort of write down some of the place-based interventions that folks wanted to see. So we had these community conversations in our 5 hottest neighborhoods, one of them being in Roxbury that you're seeing here, to look at specific cultural and economic centers in each neighborhood and talk about what are some of the physical changes that they'd like to see. So some of them that you're seeing here are, of course, more trees, wanting to see more cool roofs and green roofs, generally more green infrastructure along public rights of way, misting, more access to water. And you can flick to the next slide. So all of our community engagement, in addition to our spatial analysis, was really core to developing our strategies. Each one of the strategies actually ties back to specific comments that community members had, or sort of these core themes that we were seeing. So this is showing the amalgamation of all of our strategies. They're in these 8 layers, 26 strategies in all, where the first layer more so focuses on operations, programs, communications, focus strategies, and the second layer more so focuses on physical environment types of strategies. And you can flick to the next slide. I wanted to highlight specifically strategies for outdoor workers that we had identified through our community engagement process. And this is a brief summary of the strategy that we developed that focuses on developing our local guidelines and best practices, ways that we're going to share this information out with employees and employers, and then also working with our local or our state government as well to help produce policy for workers. And then the next slide, I promise I'm wrapping up. I wanted to share, following the release of our heat plan, what we've been doing. So a lot of this work has been led by our Office of Labor Compliance and Worker Protections. They have done a lot of work on getting information out to employers and employees in partnership with our inspectional services department. So come April, when people are re-upping on permits, there's a huge effort to put out information about the resources that folks can use to stay cool. So information through our Occupational Safety and Health Administration, OSHA, and then also through NIOSH, the National Institute for Occupational Safety and Health. They do a lot of work to put out webinars, both for the public, but then also for our own workers, and trainings for our workers. And the last thing that I'll mention is just last month, actually a couple of weeks ago, City Council passed a local ordinance to protect workers from extreme heat, and heat-related injuries and illnesses. So there is a focus on outdoor workers, but also an understanding that our indoor workers do need protections as well. And so this ordinance is inclusive of indoor workers. So I will stop there, but thank you for the opportunity to share, and looking forward to getting into more of the conversation.
Thank you, Zoe. I really appreciate that. There's so many interesting threads to pull in what you said, and thank you for bringing up the exciting developments here. Well, here in Boston, across the river in Boston, and I will say we have a mayor in Boston who is really making this issue a priority, and so there's a lot of action and activity going on here. And I really appreciate what you said about, I think a really interesting thread is what you said about culture, the culture of Boston, Massachusetts, thinking about itself as like, this isn't a problem for us. We're a northern city. There was an interesting article in the New York Times a couple of weeks ago about Paris dealing with this same sort of cultural issue. And I can tell you, I was in Paris in June when it was about 97 degrees, and that city has not come to terms with the fact that it actually has an extreme heat problem. So I think that's just a really interesting idea. But I want to go now to our panel overall. And again, pulling on some issues that have been highlighted. Again, in the New York Times, there was an article recently about the heat action plan in Rome, or a mandate in Rome to have a cessation of work during the hottest hours, peak heat hours during the day. And Dr. Mavalankar, you raised this too. Everybody brings that up as a possible adaptation. But this really brings in the question then of what happens to workers who who can't work when we get to that point where there actually might not be safe adaptations. And so we've got to turn to encouraging workers not to work during certain hours. What happens to those workers economically? And in particular, I'm interested in the uh, discussions and I don't know, negotiations with employers, or when we're talking about the informal sector, the companies that benefit economically from the work of those in the informal sector, like what's their role in dealing with this economic impact on workers of dealing with extreme heat? So maybe Albert will go to you, and then Dr. Mavalankar, Zoe, and then Dr. Joshipura. We'd love to hear. I mean, this is really where SEWA shines in thinking about the economic impact of all of this. So would love to hear too more about what SEWA is thinking about. So Albert?
Great, thank you. Important question. So I think, again, in the South African context, anything that threatens employment is a problem. And so this is a classic government answer in that we don't have the power to enact that within our city. But even if I will say that there are whether you have the regulations or not, if there's high heat, for example, customers in informal trading markets where it's not comfortable, customers don't pitch up. So there are other ways where informal workers will be impacted as well. I will say exploring potential innovative insurance products for direct payouts to workers is an option. And then, of course, we do have national regulations that that also play a role here in terms of protecting workers in that way. So we have that level of protection, but again, for the informal sector, it remains a challenge. So yeah, from my perspective, I think exploring informal, innovative insurance products is a good option. Thank you.
Yes, I think it's a major issue, yet not very clearly resolved. Who will pay for the work which was not done? And the governments are thinking, the NGOs have developed their own solution, as Professor Joshipura, Dr. Joshipura will say what they have done. And self-employed have no solution, in the sense, if there is an employer, then that employer can at least absorb some of the cost. But if you are self-employed and sort of a fruit vendor or some other vendor on the street, if you can't go out, so what we have to think about is what are the possible ways to reduce the impact in terms of shading, in terms of using umbrellas, in terms of using some of the traditional methods. Because if you see the historical pictures in India, everybody had a headgear, some kind of a head covering. Now nobody wears a head covering. So we may have to go back to those times when there was nothing like even a fan. Plus, some places there may be alternate arrangements which can be done. So it's a really important area where the government, NGOs, and the civil society have to work together. Thank you.
Zoe?
Yeah, I would totally agree that there's an opportunity to look at some of the ways that we can adapt. I think in Boston that would also not be an option. And but I do think that there's opportunities for both individuals to adapt, but also think of it from a more urban spatial scale. If the city is putting in place policies, regulations, standards to help cool the urban environment, then does sort of trickle down to the individual experience. So I think it's definitely on. There is an individual component, but there is this broader responsibility for urban adaptation as well. I would also just add there that there is definitely an economic impact to not working. There is similarly an economic impact to continue to work, and thinking about loss of life or loss of ability to come to work. So I think that also needs to be weighed as well.
Great. Thank you, guys. And I know I'm going to channel Dr. Balsari. I think I could predict if he was here, he loves to talk about, like, Dr. Mavalanka, your point about maybe we need to go backwards a little bit. Like maybe we need, what in some cultures you call a siesta during the day, that it's not just some workers should shut down, but maybe we all should take a rest during the hottest part of the day and sort of shift what is the work day to accommodate, like, just the economy needs to shift to accommodate for all of us the impact of heat. But Dr. Jeshipur, I want you to give us some hope. Like, what are the ways that Sewa is thinking about this problem? I know you gave us sort of a quick overview of some of the strategies that Sewa is using. And I'll just before you do that, I think there was a question. We're getting great questions in from the audience. There's a question about like how is the insurance industry responding, and are there new products? And I'm not sure this, I think that's a topic we could do a whole webinar on. I know I was at the World Economic Forum, and actually we had a whole session with the insurance industry on how they're thinking about new products that can address this problem. But what's happening now with Sewa workers to address this income issue?
So, to your first question, that what happens when the workers cannot work? So, they get into a vicious cycle of poverty by incurring constant debts. Because the income stops, they have nowhere to go but to borrow money from a local money lender. And in a lot of cases, we have observed that point one, the rate of interests are exorbitant. They don't have access to the formal banking system and hence have no option but to go to them. Second, then they get exploited and are forced to work more to pay off those debts. They might take loans from their relatives, close friends, and hence the cycle continues. So, in order to prevent that, there are a lot of policy advocacy efforts which have been undertaken by SEVA. The first of like some examples of it are that we had approached the local authority and had requested that if we could have mobile medical camps or mobile medical vans, wherein those vans could have been set up at the construction workers site or at street vending site. So that is what they have helped us with. And the key is that there's no point working in silos. As far as we are together, the impact always gets maximized. So that is the key. The second point is that we have been working with uh, contractors or the shopkeepers who have these informal sector workers work closely with them, and during the peak heat hours they advise our workers to take a short break like from 12 p.m. to 4 p.m. Workers might not work, although those hours might get altered later, like they might have to work 2 hours before and 2 hours after. That is the, and as I mentioned, that parametric insurance, innovative climate finance mechanisms are key. And hence, there have been a lot of policy advocacy conversations wherein we can integrate them as a part of ongoing social welfare schemes. So it becomes easily accessible and the affordability also increases because the risk diversifies.
Great, thank you so much. This just a quick follow-up. I think primarily Zoe and Albert, in you're dealing with economies that are primarily formal. What do you hear from business about their commitment? This is a question we got from our audience. What do you hear from employers about their commitment to adhering to the recommendations in the heat action plans, particularly those that are not part of either federal or state mandates, but that are, what you are sharing with them as best practices? Do you find adherence? Is there an exchange? Have you found adaptations in the plan that respond to concerns from the business community? Maybe Zoe, start with you and then Albert.
This is a great question. I think overall there is a lot of support for what's in the heat plan, generally. I would say when we start to get in the weeds, and I think this is a question of what is allowable from like a labor compliance and a legal standpoint. There are some of those specifics that need to get worked out. But I think what we have heard from folks around communicating the risks, really positive. One example of that actually is we believe it was last summer, or maybe a previous summer, please forgive me if I'm wrong, but we had worked with the GRC, the Green Ribbon Commission. It's a sort of a group of some of the biggest employers in the city of Boston. They helped to move the city's climate action work, both on resilience, but also mitigation and energy efficiency forward. And we had worked with the GRC on primarily a communications campaign where we developed a bit of a toolkit for various types of employers to share with their employees information about heat risk, signing up for the city's emergency alert system, which also includes alerts about extreme heat. And I think there was a lot of support for that work as well. We essentially wanted to say, however you communicate with your employees, whether they're folks on your team or even maintenance staff, we want to make sure that you are able to sort of put this kit together, making sure that it works for you. And we were able to work with folks from both healthcare, but also from housing. And they were able to give us some feedback on what is the best way to communicate with their staff. I think that's just like one element of it, but I think even from just communicating about the risk, positive overall.
That's great. Albert?
Thank you. So I think one of the key places of strength for us is, again, taking learnings from protecting our own workers. So there are certain industries which, I mean, obviously I'm in an office, so any internal sort of office-based worker regulations and learnings are useful. And what we found is we have really useful platforms in certain sectors to engage with them. So what we've recently found is, for example, we have what we call city improvement districts. I think in the US there's similar structures where it's sort of private sector and business coming together to improve certain neighborhoods or precincts. So what we want to do is, yes, advocate for change in terms of protecting their workers, but what we are trying to also do is to say that those businesses have an opportunity to actually improve the environments in which they are in. So what we're also trying to shift is, yes, you are in an industrial area, etc., but you can actually improve your workers' conditions by joining us in tree planting, in reducing the urban heat island, etc. So what we're trying to do is, as a base level, yes, protect workers, but also join us on improving the overall experience that people have. And what we also want to emphasize, and this is a conversation we've had previously, is around that comfort levels and people being comfortable in spaces is good for business. And we want to get businesses involved in that, not just formal, but informal as well.
Great, thank you. And that ties to a question we also had from an audience member about like using different building materials. So sort of getting ahead of the problem. So if you have an employer who's building a new facility, I'm sure there are efforts to get them to use materials and strategies that will ensure that the temperature in at least inside doesn't become dangerous. Dr. Mavalanka, I want to direct a question from the audience to you. So as we said in the introduction, your initial works on the first heat action plan is credited with saving a tremendous number of lives. But sadly, there are workers who are still losing their lives and getting very sick from exposure to heat. As you've seen this progress, there's a question about which workers are you tracking, or do you know the folks who are still in the government in Ahmedabad, are they tracking which workers, sort of getting the next level of specificity, are still the most vulnerable? And how do you think about then adapting the heat action plan as you get this data in? Like, what's that feedback loop?
Yeah. So as of now, our health data systems are not very strong. So we don't have lot of data on who is specifically dying during the heat waves. Of course, the mortality has gone down, but it doubles it instead of tripling during the heat wave. So there are still people. Our basic analysis shows that most of the deaths are in the elderly and comorbid people. It is not that the most deaths are in the exposed workers. So, of course, exposed workers are suffering, but they are generally younger and much more fitter. So, the proportionate of death in that is likely to be less. What has also happened is the city government has revised the plan each year after the heat season with the Public Health Institute, NRDC, and the city government. There is a joint review of the heat action plan, what actions were feasible, what were not feasible, what could have been improved. And as new knowledge and experiences came, additional things were added. For example, after first 3 years, the Indian Weather Service started predicting heat. Till 2016, we had to depend on Georgia Tech University from US to provide us the heat predictions because the Indian Weather Service was not predicting, it was just reporting yesterday's temperature. So that major change happened after our work. Then um, the city government also appointed a heat nodal officer, which was very important, a deputy health officer as a heat nodal officer, and he has been consistently working on the heat side. Some of the hospitals have now developed the best heat stroke cooling system, which is they have really cold water bathtubs. So hospitals have installed in their heat cooling wards bathtub with chilled waters because that is the fastest way to save a person who has heat stroke. Some of the heat island mapping has been done by the city universities and some NGOs, and vulnerability mapping also has been done. As you heard, NGOs have started the parametric health insurance. So there are many changes. School roofs have been promoted in the city. Uh, it doesn't mean that most of the things are done. I think we have done maybe 30% of what needs to be done, 70-80%. And heat is increasing each year. So we are sort of doing a catching up with the climate change, what is happening. Of course, national government is also taken note, and heat is now decided as a natural disaster. So far, heat waves were not considered as natural disaster. Only cyclone, earthquake, and some man-made disasters were included in the disaster management list. So many new guidelines have come. The health department has now a surveillance system for heat-related admissions and mortality, etc.
You raise a really important issue about the quality of data. That's something obviously we're thinking about here in the US. How are we tracking this and understanding what these trends are? You probably know here in the US, and Zoe, I think you made reference to it, NIOSH, which is National Institute of Occupational Safety and Health, part of CDC, has been responsible for a lot of that data collection and research in the US, and their capacity has been greatly diminished over the past few months. So we've got serious issues here in the US too with data. Dr. Joshipura, I wonder, just same question to you, but like give us the on the ground, if you can, what SEWA is seeing. Where have you seen the most improvement? Are there particular occupations where you've seen a particular improvement in adaptations, or are there occupations that where the problem is getting worse? I know when we were in India, some in our group went to see the salt pan workers. That would seem to be an occupation where it's still, I know you say was doing important work to try to protect those women, but that's a very exposed occupation. So tell us just sort of that, give us that personal touch of who is most at risk among your members and where is the story getting better?
So at risk are the workers who are into multiple occupations, like the ones who are in outdoor settings, which include soil pan workers, construction workers, head loaders. Then there will be bangle makers and home-based workers. They are also susceptible to lot of heat-related illnesses because they undergo the double whammy. So what happens is that it is not only the heat, but the indoor environment heats up. And additionally, they are working in front of the machines which generate heat in front of the fire furnace, which is generating heat as well. Then there are waste recyclers and street vendors. They have nothing on their heads, so it's a direct scorching heat that that impacts them, and then the tar roads also get heated up. So that is one point. And in terms of the positive light that members have as a part of the campaign that Seva has undertaken, members have started understanding what is climate change, what is impact of climate change, how they are getting impacted, and as a result of it, they have themselves started scaling up locally led innovations. Like, instead of taking multiple vehicles, members have started pooling vehicles, or they have started reusing their own clothes to make reusable bags. They have started generating other sources of livelihoods, like, for example, the solar training that's ongoing. Then there are insurance agents, then there are climate entrepreneurs that we have. So these are the small steps that members are taking. They have started using the cool roof paints. Members have started installing skylights to ensure there's ventilation and the heat gets minimized. Members themselves are becoming aware about the criticality of data and hence have themselves started participating. So these are the small positive signs of life that we see at the other end of the tunnel.
Okay, we are almost at time. So I'm going to do a lightning round, like 30 seconds, each of our panelists. I always like to end on an up note. So tell me like one concrete thing that is giving you hope in dealing with this this crisis. Dr. Madalankar, let's start with you.
I want to end with a very positive note of this real-time story. In June 2024, which is one of the very hot times of our times, there was a Jain monk, one of our faculty colleagues' brother who became a Jain monk, was walking his religious duty in Western Rajasthan, which is a very hot place. And 8 o'clock in the morning, he developed severe heat stroke in a very remote place. And luckily, he had two monks along with him, so they took him to a local primary health center of the government. And he was unconscious with convulsions, which is a very severe form of heat stroke. Fortunately, the doctor had enough training, skill, and the presence of mind, and he treated him so well that within 2 days, this Jain monk became completely normal and started his religious duty back in the same heat again. So, this shows that if our health system is ready, even in a very remote area, they can manage very difficult heat stroke cases. So, that was a very positive thing. When we learned, we were very happy about it. Thank you.
That's great. Thank you for sharing that. Zoe, what's given you hope?
Honestly, the fact that we have approved a local heat ordinance. We honestly weren't sure if it was going to go through as soon as it did. There was a lot of support for it, but excited that it's going through. And uh, we in Boston, so we have a moratorium on winter projects, so no construction over the winter time. When that breaks in spring, there's a large convening of a lot of them are construction workers, one of the largest convenings. And so every year there's an opportunity to share more about the impacts of extreme heat, this ordinance, the resources that we have. So yeah, I think that's really exciting.
Awesome. Albert?
Thanks. I think what gives me the most hope is that we don't have to come up with new ideas. I think a lot of cities are already doing excellent work, and it's about exploring how that works in our context. So that really gives me hope. Thank you.
And Dr. Joshipura?
I'll be very short. 3 words: sisterhood, solidarity, and organization.
I love it. I knew I could count on Sewa to really end us on a high note. Okay, I'm gonna give it back to Hitesh, but I just want to thank you all. I'm so excited to continue to dig in with all of you over this year as we launch this scholarly working group. But thank you for just a really, really great conversation. Hitesh?
Thank you, Sharon. First of all, thank you for leading us so expertly through that conversation and for helping us put it together. And I do want to say to everyone who's listening, thank you also for joining us, staying with us for some very thoughtful questions that you've put up there. And I also want to point out the thing I said at the beginning, which is that it's an extraordinary panel, has turned out to be true, and Sharon herself noted that also. I've learned so much, but I have to say the most astonishing thing is to know that there are people doing very intelligent, thoughtful work to try to meet this challenge at different levels, from thinking about the most vulnerable to the larger society. I knew about the work Dr. Mavlankar was doing because he was one of our hosts in Ahmedabad when we were there as part of our climate conference in the spring, and we were blown away. But really, Zoe, Albert, and Rajvi, I'm also very much taken by how deeply you're thinking about this and working on it. Albert, I also learned that where you are in South Africa is essentially a Mediterranean climate. I hadn't quite thought of that. And Zoe, it's very nice to have a report from Boston since we're right next door here. I actually noted, Zoe, in your presentation that some of the hottest parts of the city during heat waves are also some of the wealthiest. So it's not limited to the poorest areas of the city, uh, which is very interesting too. And of course, we have a very able mayor here. So thank you all very much. I want to also thank the Mittal Institute team in India, which has helped put this together, especially Yuvika, Shreya, Angarika, led so well by Monica, who heads all of our operations in India. I want to thank our co-hosts, the Harvard Center for African Studies at their Africa office, and the Center for Labor and a Just Economy at Harvard Law School. Thank you all. The work continues, Sharon. It's really a pleasure and a deep joy to be connected with you and to continue this very important work. See you all again soon.